As the CMA walks the path of reconciliation, we're standing with Indigenous peoples to break down barriers to good health. We've called on government to provide clean water to Indigenous communities, a basic human right. We stand with survivors and their communities in ending harmful practices that have resulted in the forced and coerced sterilization of Indigenous peoples, an appalling practice that's happened within the last 5 years in Canada. As Canada's wildfire season worsens year by year, we're asking government to honor Indigenous knowledge and climate leadership by funding Indigenous-led, land-based approaches to addressing the climate crisis, to safeguard the land's resources and sustain our health. We're applauding the recent efforts from people with lived experience in residential school and allies to combat residential school denialism. And as governments work to improve the sharing of health data, we're calling attention to the need for Indigenous data sovereignty to ensure that First Nations, Inuit and Métis peoples have control over what information is collected about their health and how it's being used. These are just a few of the ways that we can and must do better to protect Indigenous peoples' right to health.